This is my good friend and colleague, Jacqueline DeVries, who is the director of the Crossroads Center in, is it?
New Jersey.
It's just in New Jersey, right off 17, what's the town?
Ridgewood.
Ridgewood, and it is a beautiful, beautiful facility that she has just set in motion.
I met Stephen, and I'm trying to think of what year it was, but I'm thinking it was in 2006 or 2007. I was referred to his practice because I had been diagnosed with chronic fatigue syndrome, and besides chronic fatigue syndrome, I could no longer get my brain to work, which was a bit of a problem since I worked in computer science research at a very well-established laboratory, and not being able to think was a bit of a handicap. So I started working with Stephen using the lens, and I was a very reactive client, but the lens allowed my brain to get going again. And despite having sought out some of the best physicians in the New York, New Jersey area, nobody could really figure out what was wrong with me. So as I was able to start thinking again, I started applying my research skills to my own situation, and I was able to find a path slowly but surely out of the chronic fatigue syndrome and discover what my different problems were. With Stephen, so I worked with you probably for about 5 months, and then I, because I live in North Jersey, I said, how about if I get a system to use at home? And actually at the time we were also working with one of my children. And so I came and I did a class, a lens training with Stephen. And from there I started working with myself and my son at home. And that started a lot of interest in the community of people who were around me, and I started offering really pro bono sessions to people to come and try it and see what it did for them. And that's kind of how I started, and I got my chops wet in learning to work with the lens. So first of all, working with myself and my son, and then a few friends and family.
And I should mention that Jackie was functioning so well that I was looking for some people to volunteer and help us put on the first International Lens Conference it was right near here at a place called LifeBridge Foundation, and it was a knockout. We had, I think, 75 people from 5 different countries, and Jackie was just like right on it, and I knew she was getting better at that point because she was probably functioning higher than Len was, and it was hard to get Len in to kind of look at the website with us, but we were doing just great at boot camp and all this kind of stuff, and designing the conference very successfully. Len was to say himself after it was over, he said that was the best run conference I've ever been to. Of course, it was about himself.
Well, and that was another learning experience. That was another huge learning experience. So that was really, really valuable. From there, I went on to learn a variety of different modalities. I think shortly after that, the neurofield came on the scene, and I did some development work with databases for the neurofield. And actually, that's kind of what brings us to the reactive attachment disorder case that I was telling you about. I started working with an 11-year-old boy who was adopted from Romania when he was 3. And the parents knew the parents who had adopted his half-brother. And that had worked out very well. And they had 3 biological daughters, and they wanted a son, and they thought adopting was an appropriate way to go. So they adopted him from Romania, and he had been in an orphanage. They didn't really know too many of the details about his time in the orphanage. And
under Ceausescu, I imagine.
I don't know. I don't know. So they brought him home. They lived in California, and what happened next was that all semblance of family life ended. This was a child who had very, very serious emotional problems. He was oppositional. He just could not function in a family setting. the mother was a nurse, and she had to leave her job and spend basically 24/7 trying to contain this child. Their daughters were all substantially older, but despite the fact that they were older, it really had an enormous disruptive effect on the family. In California, they tried everything. Every suggestion that was made to them, they pursued and tried to see what they could do to help this child and to help their family system, because there was such a disturbance there. Then the father was transferred to New York, and they joined a synagogue where the physician, the functional medicine practitioner that I work with, Cheryl Leventhal, is a member there, and Cheryl said to the mom, "Why don't you take him to see Jackie?" And then in a panic, when the mom said, "Okay, I'll do that, like give me the information," she called me in a panic and said, "Oh my God, I don't know what I've just done. This child is like completely out of control. I don't know, I'm so sorry if this is a problem, blah, blah, blah." So, and I said, "Don't worry about it. Let's see what happens, And he was pretty out of control. This was a child who would sweep into the office and attempt to sweep off everything on the desk, every monitor, every computer, everything. And so he was pretty destructive. We started out doing a traditional program. We used the lens. We used some traditional neurofeedback also. In the first 4 months, he also did a full biomedical workup. And what that allowed us to see is it allowed us to see that he had lead and cadmium toxicity. It allowed us to see that he had some very severe food intolerances. And he also had some amino acid deficiencies. So all of those things were addressed. So he had a chelation protocol. He was given direct amino acids to bring his system into balance. And he had to forego French fries, all potatoes, peppers, onions, and I'm trying to think if there was anything else. It was sort of an odd combination of things that he couldn't have. And he had to forego that for 6 months. And after 4 months, we did some follow-up testing with him, and his intelligence had increased by 12 points. And he was sitting there looking at those results, and suddenly this child, who was still not a wonderful person to be with, but he was improving, suddenly realized that he was actually smart. And that made all the difference in the world, because he started having some self-esteem. He started feeling good about himself. And it was about at this time that the Neurofield came out. And so I continued working with him on a slightly modified protocol of once a week. But I started going through all of the frequency books, and I made a custom protocol that had everything from to stop whining, to stop anger, to enhance spiritual connection, to enhance calmness, to reduce anxiety. And I put all these frequencies together in something that I called emotional well-being. And I would also treat him with those frequencies when he came in. And this system was really completely brand new. We had no idea how it really worked. And it worked magic on him. Within about 6 weeks, he was opening the front door for his mother. So he was starting to connect to people. He was really starting to be responsive to people. And I continued working with him using both lens and the Neurofield for about another 6 months. He was also doing home exercises at home to address what are called reflexes. So in the body, in a developing baby, infant, toddler, you have primitive reflexes that need to integrate in the body so that actually the myelin sheath properly builds up from the brainstem around the cortex. And it turned out that we sort of figured out that he had been tied in a crib and not allowed to move when he was in the orphanage. So he hadn't done any of the normal creeping and crawling and scooting and all of that stuff that helps that whole process happen. But we were surprised to discover that even with doing those exercises, the reflexes were not integrating for him. So at the end of that year, we had a trainer come in, and I brought another person into my practice who was solely focused on reflex integration. And the trainer taught us how to do the Mazgatova methodology. It's one of the 3 or 4 different approaches to integrating reflexes. And then he would go and have sessions with her twice a week to work on the reflexes. And fortunately, in about 4 months, all of the reflexes had come together. And he was now a very calm child. He was really starting to perform well in school. And the school said, listen, this is what they told his parents, we think if we focus on catching him up academically over the next school year, he will be able to mainstream. And that is precisely what they did. So he was in a school for emotionally disturbed children. He had previously had a full-time aide. He no longer needed the aide. And they spent an entire year getting him academically caught up so that he could mainstream into the middle school in his town. The summer before he mainstreamed, he still had a problem with reading. And so we brought him back, and using one of the modalities that we're trained in called applied physiology, it lets you look at subconscious and unconscious conflicts that are driving you. He was able to discover what was behind his reading difficulty. And the minute he got that, his reading problem was gone, and he was able to read perfectly. So he mainstreamed in the fall of 7th grade, and they stepped him into some of the classes step by step instead of putting him in everything regular right from the beginning. But by January of the following year, he was all in regular classes, no aid, no extra support, and he continues to do extremely well in school. He is a wonderful asset to his family, and we were very touched and blessed to have been able to work with him, and we have incredible appreciation for the degree that the family went to do everything that was required to help him really recover from this reactive attachment disorder.
I bet the family dynamic improved.
Oh, hugely.
Yeah, because
absolutely.
When he comes around,
Yeah.
he's welcome. And,
Yes,
yeah,
yes,
that's wonderful.
absolutely.
Did you use the infra-low frequency on him, the ILF?
No, that was before we had ILF. Yep.
I see. It's quite fascinating. When I first saw that the neurofield, just to mention quickly for people who don't know about it, is a device invented by Dr. Nick Dogres to help his own child with pervasive developmental delays. And it is not true biofeedback. It's more like energy medicine, and it operates on the basis of frequencies that the practitioner has to find and devise. So when I first saw in Dr. Nick's machine, you have a protocol for whining? That must have been developed by somebody from New Jersey. Where did that one come from? But they have protocols for emotional calming and.
Yeah, that's actually the protocol that I had
Oh, is that
developed,
the one? Yeah, and we've used that with remarkable effects with
Yes.
with kids. But Jackie, maybe if we just have a couple of more minutes, tell us a little bit about why you have found the infra-low frequency, or the ILF. That's in the new book, by the way.
Yes,
But
I
it's
saw that.
only 2 years since.
I've been using that. I've been using that for 2 years.
Okay.
Yes. Yeah, that's correct.
What have you found with that?
So what I found with that, well, it's interesting because at the Association for AAPB, I'm not even sure.
Association of Applied Psychophysiology and Biofeedback.
Thank you.
That's why they say AAPB.
Yeah, so at AAPB there was actually I was part of a panel that talked about our experience with ILF, but it was interesting because Tom Kalura and Siegfried Othmer talked a little bit more about what actually ILF is. And it's almost like what we're tapping into is a bioresonance that's part of the brain, but it's also part of the body. And so this infralow frequency training, what we found is when we do that kind of training with someone who is kind of out of sync with things, it starts to synchronize their whole body together.
So it has physiological.
So it has physiological effect to it, yeah. And I have found that to be the most remarkable protocol to work with children that are on the spectrum. So I almost always now start children there, and once we know what their frequency is, which requires a little work, then what we see is we see the kids relax. We see them get calm immensely quickly. And then they're more accessible for doing all of their other therapies. They're more accessible for all of the other support that they need. I have also found it to be incredibly helpful for people that have had traumatic brain injuries. So I'm working with people that have had, I'm working with a heart attack person who's had 10 minutes of anoxia, lack of oxygen. He was dead for 10 minutes and resuscitated. When I did the QEEG with him, everything looked like he had no power. So I went for the neurofield. I actually went for the lens. I went for all of those kinds of tools to help kind of spark the brain and get the power going. And it didn't really do it. And so I was kind of sitting there scratching my head, and I decided one day to do ILF, and immediately it synced something in his system, and he started cracking jokes. I mean, this is a guy who can't remember like anything from yesterday. I mean, the memory system is completely missing at the moment. He has long-term recollection, but all the short-term is kind of gone. And he started wisecracking, which is how he used to be. And the wife was so excited. She was like, he's quipping. He's making his smart remarks again, which weren't always appreciated, but wow, he's coming back. And he is. He's about to leave on a vacation, and he knows where he's going on vacation. He remembers. So he's on his way back, and I really...
Didn't you do a detox with him too? Or?
No, he has not done a detox.
Not done detox?
No, he has not.
But
yeah.
just the ILF?
Just the ILF was the thing that kind of flipped him, which was pretty exciting.
The reason this protocol is so controversial, and it's called infra-low frequency, is that it's below the normal EEG, the measured in hertz. This is a fraction of a hertz.
Right.
And the corner frequency has to be found. That's the little difficult part, because the practitioner has to be right on it and help the person find that corner frequency. And when you find it...
Yeah, once you find it, then amazing things happen. So it's a bit of a job to find it. The other interesting case that's sort of like that is a woman who had an aneurysm rupture when she was 29. She's 41 now, and they diagnosed it incorrectly when she went to the emergency room. They thought she was having a heart attack, and so they treated her for a heart attack, and so she didn't get the kind of crucial care that she needed in those first few hours. When they did realize that she'd had a stroke and that it was an aneurysm, she had surgery, there was an immense amount of brain swelling, they removed the top of her skull, and again, they kind of didn't do quite the right thing, and that bone was not preserved properly, and it died. So then they had to take hip bone and put that on the top of her skull. So all of these many factors, this woman was left with... she was left very, very impaired. So she has right side paralysis, she has a quarter field vision, which is not that much. So I met her 12 years after the incident, and she could speak in 2- and 3-word phrases, and that was about it. And if there was a weather system coming through, there was so much inflammation in her body that she could no longer really productively speak. She couldn't really do any cognitive computation in her head or really compose things in her head. Everything had to be done one thing at a time. So when I did her QEEG, it was a little bit tricky because she has 4 metal pins or screws holding down the bone that's going across the top of her skull. So I looked at the QEEG and I was kind of like, okay, I don't know if this is her brain map or if this is signals bouncing off of metal screws. But I made a plan for how to work with her. And what I did initially was I did do ILF with her initially. And within 4 sessions, she was speaking 10-sentence words. She no longer...
10-word sentences.
10-word sentences, thank you. I need a little ILF, no. She was able to, her vision expanded, so she has half field vision now. And the weather was no longer affecting her production of speech.
That's amazing.
And so I have since gone to do neurofield with her, which has further enhanced her abilities. I've done the lens on the homunculus, and now she has sensation on the right side of her body. She can feel her arm, she can feel her leg, she can feel the side of her face. She can sense temperature now, which she couldn't do before. And I'm also working in conjunction with another therapist with her who is also doing laser therapy with her. And in conjunction with what I'm doing and with what this other practitioner is doing, she's now able to open her arm. She's starting to move her arm. She's starting to move her leg more actively. This is after 12 years.
Wow.
Okay, so anybody who has questions about neuroplasticity, we see it every day. Amazing things happen if our minds are open to it and we have great tools to work with.
Thank you so much. That is those are really amazing clinical cases. And when I